Weekend, an eye-opening conference will be held looking at disparities in healthcare. Statistics show that there is a real disparity when it comes to health based on actually where you live.
As Channel 2's Claudine Ewing tells us, organizers call it an untold health crisis.
It's what's in this task force on healthcare disparity report that has forced a group to come to push for a solution.
It's not a resource issue, Claudine. It's a priority issue.
Regardless of access, regardless of primary care, regardless of hospitals, if you live in a particular zip code here in Buffalo, New York, that is a direct correlation for your health. And that's what's startling.
And here are the zip codes: 14204, 14206, 14211, 14212, and 14215. According to this report, you're almost 3 times as likely to die prematurely as a white person living in a different zip code in Buffalo. According to the report, inner-city African Americans have higher rates of serious and chronic diseases like hypertension and diabetes. Black children are more often hospitalized for asthma, and infant mortality among blacks 3 times that of whites. As for Erie County,
out of 10,000, 11.1 infants will die. That right there, that statistic, is higher than some developing countries.
And then there's breast cancer.
When we do get breast cancer, we're more likely to die from breast cancer. And that doesn't matter about having health insurance. It doesn't matter about education. We are more likely to die.
So solutions are across the board, but healthy options are needed. That's where Project Rainfall comes in. They will open up on East Delavan in a zip code with a healthcare disparity.
A third of the building is going to be a farmer's market that'll be opened every day.
The rest of the building will be used to grow fruits and vegetables.
We have issues about access to food and access to healthy food in particular on the east side of Buffalo, and we see that as a root cause to persons being and are suffering from chronic conditions.
That is why a task force was formed to look at the root causes for these disparities.
African Americans will live about 12 years less than whites in this community. That's completely unacceptable. That is not the definition of a community that's in renaissance or resurgence or revitalization.
The free conference is Saturday, 8 to 4 at the Jacobs School of Medicine.
But if we really want to move the needle and if we want to eliminate these health disparities, this has to be a community collaboration.
Claudine Ewing, Channel 2 News.